So I chaired the DEWS 2 or dry eye workshop that started in 2015 and went through 2017. That was a report that had 150 members from 23 different countries, and we had 12 subcommittees. The DEWS report really provides the current state of the art as far as the diagnosis and treatment of dry eye, as well as the pathophysiology. One of the key elements of the pathophysiology is the concept of evaporation and tear osmolality. That evaporation leads to increase in tear osmolarity that can cause damage to the ocular surface, especially to the epithelial mucocutaneous junction with the glycocalyx. In addition, osmolality in itself can cause significant damage, causing pain, discomfort, and the like to the ocular surface. The report breaks dry eye down into two different types: aqueous tear deficiency and evaporative. Aqueous tear deficiency can be due to Sjogren's syndrome, where there's a dysfunction of the lacrimal gland and inflammation of the ocular surface. It can also be due to sensory denervation of the lacrimal gland and the ocular surface, leading to decreased tear secretion. In addition, the most common cause of dry eye is evaporative, related to meibomian gland dysfunction. The tear film report emphasizes the tear film is really two layers with a large mucoaqueous or aqueous mucin tear film with an overlying lipid layer. The surface of the eye with the epithelial cells has a membrane-spanning mucin that allows the tear film to adhere to the ocular surface. The mucin layer as well as the lipid layer are quite critical in preventing tear evaporation. The sex, gender, and hormone subcommittees looked at the effects of hormones on the ocular surface. All of the ocular surface is influenced by tear film. It's helpful to think of estrogens as being pro-inflammatory and androgens such as testosterone as being protective. Autoimmune disease is much higher in women than in men, and likely due to the influence of hormones. The pain subcommittee looked at the effects of pain and innervation of the ocular surface. The ocular surface is innervated by neurons from the trigeminal ganglion. There are three major receptor types on the ocular surface: the polymodal, the mechanical, and the cold receptors. The cold receptors are important that they are the ones that are firing all of the time and lead to tear secretion and blinking. The concept of neuropathic pain is also important. It's pain that can be peripheral due to damage of corneal nerves, or central due to hypersensitization of nerves due to the effects of microglia. The definition and subclassification committee looked at the definition. The definition is dry eye is a multifactorial disease of the ocular surface characterized by loss of homeostasis of the tear film and accompanied by ocular symptoms in which tear film instability, hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play key etiologic roles. The classification system looked at asking, does the patient have symptoms or not? Patients that are asymptomatic, then the question is, do they have signs or not? Patients that are asymptomatic with signs need to be evaluated for conditions that might lead to corneal surgery and have an influence on that. In addition, there are patients who are symptomatic and have signs. These particular patients, once you've excluded other cause of inflammatory disease, actually have true dry eye. And then patients with symptoms but no signs either fall into a pre-dry eye state or actually have underlying neuropathic pain. The epidemiological subcommittee showed that women are more likely to have dry eye, and overall the incidence is probably around 10 to 15% based upon the presence of signs and symptoms. The management and therapy subcommittee suggested that patients be screened to try to rule out other types of inflammatory disease, and then a questionnaire such as the DEQ-5 or the OSDI be used to assess symptoms, and then signs are measured from the standpoint of non-invasive tear breakup time, tear osmolarity, and corneal staining with lissamine green and fluorescein. Having both symptoms and one of those three signs present leads to the diagnosis of dry eye. And finally, iatrogenic dry eye can be related to drug. It's both topical and systemic, contact lenses, surgery, and that includes both ocular surface surgery as well as lid surgery. And then finally, the role of cosmetics is examined as it relates to toxicity of the tear film and having effects on the eyelids.